So Charlotte and I are both from the Northern Training Consortium, or NTC. I'm going to do a double act. So I'm going to start off and introduce the consortium and explain how it works. And then Charlotte's going to tell us how she manages to deal with so many trainees all at the same time. I think we're up to 29 STP trainees at the minute. That's quite a task. So the consortium has been around for over 10 years now to support work-based training in the North East and North Cumbria, mainly in the physical sciences and clinical engineering, but also in some related physiological sciences specialisms that have strong links to medical physics. So it grew out of an old regional medical physics training department, which used to spread from Newcastle across to North Cumbria and down to South Teesside. But when that medical physics department was fragmented into different trusts, it was thought that it would be helpful to retain the links for training between the different departments and benefit from sharing expertise and resources, and particularly sharing infrastructure. So the consortium is a partnership of 8 trusts who work together to manage training. And it's underpinned by a statement of agreement that's signed off at executive director level. And a lot of the hard work setting up this statement of agreement was done by the previous post holders, Alison Mackey, who did a lot of work setting up the consortium, and Emma Bowers, who was a previous training coordinator, and you may now know because she's moved over to a key role in STP training within the National School. So we support training across all of the different training schemes and the different specialisms shown here. The bulk of our time is spent on the scientist training programme, and we have 12 different specialisms at the minute. We also support the other training schemes as well, but for those schemes, we're more involved in getting funding and sharing resources, whereas for the scientist training programme, we also do a lot of the management of the actual trainees as well. The structure of the consortium has changed slightly over the years, and at the minute, it's a partnership board model. And the idea behind that is to share the accountability and responsibility for the consortium activities more widely across the region. The bulk of the board is made up of healthcare science specialism representatives, 1 for each specialism, 2 for the larger specialisms. But we also have input from colleagues in the education, workforce and training department and finance as well. There are 2 infrastructure posts. There's a director post, which is for 1 day a week, and that's myself. I'm seconded from my day job. And there's also 2 days a week for a training coordinator, which is Charlotte. That was also a secondment to start with, but now is a permanent post. And we also have a day a week of admin support, which is invaluable for sorting out things like travel and accommodation for the education academic training docs for the trainees. So there's 8 different trusts involved in the partnership, but the consortium has to live somewhere. So it's hosted within Newcastle hospitals, mainly because the bulk of the healthcare science workforce in our specialisms resides in Newcastle. It's within the Medical Physics Directorate, but the finances and the governance are completely separate to the rest of the Medical Physics Department. And costs for the consortium are shared across all the partner trusts in proportion to the amount of healthcare science scientists they have in our specialisms. All of the STPs are actually employed by the consortium, so they're employees of the Newcastle Hospital, even though they may be working anywhere within the region. And that's slightly different for the HSST and apprentices who are actually employed by their host trust. This is the current board. You might recognise some of these faces. There's 1 rep for each specialism and 2 for nuclear medicine and radiotherapy. And then we also have the education, workforce and finance team as well. The role of the people on the board is to be the voice of their specialism across every trust in the partnership and at all stages of the career framework. At the minute, all of the representatives are healthcare scientists rather than technologists, but they don't necessarily have to be. So what do we actually do? Well, recruiting and managing trainees is an enormous amount of work before you even get to doing the training. So working as a consortium means that we can centralise all that administration and free up the individual training departments to concentrate on the core business of delivering their specialism knowledge. All of the STP trainees are employed by the host trust, which is Newcastle, so we can manage the recruitment and the induction processes. We organise all the interviews. We don't actually do the interviewing ourselves. That is done by the specialism. people, but we can do all of the organisation and documentation around that, which is a real help. Charlotte, as the training coordinator, does a lot of rotation timetabling because we have so many trainees needing often to do overlapping specialism rotations. So we can try and organise it so we can double things up and make things more efficient. And she also helps with training plans as well. The training coordinator is also the training officer for all of the year one trainees, regardless of where they are, and does the supervision of some of the core modules like the professional practice module and the individual professional practice. Because they're employed by Newcastle, then we can sort out things like absence management and deal with all the study and travel, accommodation, administration. We tried to create helpful resources that everyone can benefit from and run workshops for things like final assessments and reflective practice. I think one of the big advantages of having a very formal consortium structure is that we can then be a key point of contact for other stakeholders. So people like the National School and NHS England can contact the consortium via a very defined route. And we can also sort out a lot of the paperwork that's involved in having trainees. We do things like manage all the accreditation and also things like the surveys and the scoping exercises, which seem to come around every month or so. Other things we get involved in are a lot of the regional healthcare science groups, both within our region and also further afield. And we do things like advocate for things like better PTP funding, for example, and represent the training needs within the region for all the different specialisms. We have an annual meeting, usually in the summer, and that rotates around the region. We usually start off with updates from the National School and updates from our workforce leads about commissioning, whether there's going to be any money or not. And we often have really interesting invited speakers. So this year we had an excellent talk from Jo Horn from the school talking about how to support neurodiversity within training. We tried to cover all the different range of training schemes. So we had talks about sharing resources for apprenticeship training. And then this year we had Nick Bennart, who's now head of medical physics in South Tyneside and Sunderland, giving us his view on what the benefits of having done HSST were in gaining a consultant post. Last year, we had a talk about HSS equivalents. In the afternoon, there's a presentation competition, and we invite all the STP trainees to submit an abstract on an interesting bit of work that they've done recently. The abstracts are judged by the HSST fellows, and then the top scoring abstracts are presented, and there's a little competition with prizes for the best delivery and questions. Last year, we also invited the apprentices to submit abstracts, but they haven't taken us up on that offer yet. So maybe next year it'll be apprentice that wins. We always try to look for innovative ways for the trainees to fulfill competencies. So this year, one of our clinical informatics trainees has actually designed a new website for us, which is something we've been meaning to do for a while. And hopefully that'll tick off quite a few competencies for her. We've got a competition to design a new logo as well, because we know ours is a little bit rubbish. Trainees are not just SCPs, we also have a lot of apprentices within the region. And something we've been concentrating on the last couple of years is trying to improve the support we offer to level 6 trainers and trainees, and try and get the regional cooperation for apprenticeship training that we have for the STP as well. So in 2023, we were really fortunate that we managed to secure through the consortium full funding for 10 level 6 apprentices, 5 in nuclear medicine and 5 in radiotherapy. That funding came around at really short notice, and we had to really scrabble to get things together. So being able to do things as a team really helped us take advantage of that money that wasn't available for long. So because we had so many apprentices all starting at the same time, we were looking at ways of sharing the training burden, because we had 5 nuclear medicine trainees spread out throughout the region. So one of our previous STP trainees, Kieran Hamilton from South Tyneside, put together an introductory course for the nuclear medicine apprentices that could be run by teams and just take a little bit of that burden off the individual training centres and let the trainees get to know each other and some of the trainers throughout the region as well. We've got a similar course in radiotherapy that's been running for a few years, and we use that for apprentices and Route 2s. And that's also available for trainees elsewhere in the region too. And lastly, our trainees are also very involved in outreach and careers events. So these are some pictures from a careers day that we had in Newcastle in radiotherapy a couple of weeks ago. We've got one of our current STP trainees, Tabby, who made some fantastic resources to explain how treatment planning works to school children, and Craig, who's one of our previous STP trainees, doing some demonstrating there as well. We also get a lot of requests for work experience. It's a very valuable thing to do, but incredibly time consuming. And it does seem to be a bit of a lottery as to whether people get offered experience or not. So we're trying to make a more formal offer for that and have something very structured, whereas we have a couple of weeks a year where we can offer work experience and people can apply for that, for places on that, and do it in a bit more of a formal way. Okay, so to summarise, what are the advantages of working within a consortium? Well, as I said, recruiting and managing trainees is a lot of work even before you start training them. So centralising all that and doing a lot of the administration involved with trainees really frees up the centres to concentrate on delivering the actual training. It also allows us to make use of all the training capacity that we have within the region. We've got a lot of small centres that want to be involved with training, but couldn't host a trainee on their own, perhaps because they don't cover the whole breadth of the syllabus in their specialism, and also they need to be able to send their trainees on rotations to other departments. So having a sort of central way of managing training across the whole region really allows us to make use of all the training opportunities there are, particularly in those smaller centres. It also allows trainees to move around the region, and they get to experience working in different centres and with different equipment and different people than they would if they were just based in one place. And I think that might also help with recruitment as well. So trainees might have only considered working maybe in a bigger centre, say Newcastle, but if they've already experienced working in one of the smaller centres and met those people, then they can end up working there when they might not otherwise have considered that. And we actually have quite a good retention rate for our trainees. So the last time that we audited, 80% of our STP trainees ended up working in the region within the footprint of the consortium, which is great. And also, because we have such a critical mass of trainees, it means they have a really good support network. And the trainers themselves, because we work so well as a team, we also can support each other. So the challenges, obviously, increasing the number of trainees is a challenge. We all have workforce shortages and we'd like to take on more trainees. We've almost doubled the number of trainees since we started the consortium, but we're probably at the limit of what we can do with the current resources. We need to keep abreast of all the changes. STP in particular, there's been a lot of changes to recruitment and final assessments recently, and making sure that everyone is aware of all these changes is an ongoing challenge. And finally, funding is always difficult, both for trainees. At the minute, STP is the only training scheme that's fully funded, so we really try to advocate for better funding, particularly for PTP or level 6 trainees. And we're very grateful that we did manage to get those 10 fully funded posts last year, but also funding for training provision. So there is practice educator funding around, but unfortunately, we've not been able to access that because our posts already existed, and that's a bit frustrating. We'd really like to be able to access some practice educator funding to help us increase capacity further going forward. Okay, so I will hand over to Charlotte and then we'll have questions at the end if anyone has anything they'd like to ask.
Perfect, thanks Jude. I'll just share my screen. So as Jude mentioned, I'm just going to talk through how you manage trainees within a consortium. So our new website is released on the 6th of January. So if anyone wants to check it out, then a lot more information on the Northern Training Consortium will be on there, and we'll be rebranding, which is very exciting. Sorry, my slides are not moving. There we go. So the few things I'm going to go over today, just to recap on the specialisms and the regions within the NTC, the role of the NTC training coordinator, and some top tips when managing trainees within a consortium. So as Jude mentioned, the specialisms we cover kind of base from medical physics. So the majority of our trainees are within medical physics, split between the 4 disciplines. but we also cover clinical engineering, clinical informatics, clinical scientific computing, gastrointestinal science, ophthalmic and vision science, pharmaceutical science, reconstructive science, and urodynamic science. So quite a broad range of specialisms there, but they all kind of have a core bit in common. So for our current cohort, we have currently 2 trainees doing clinical engineering, 1 doing clinical informatics, 16 doing medical physics, 1 doing ophthalmic and vision science, and then 9 doing pharmaceutical science. So we've had quite a few more pharmaceutical science trainees this year. So we've got 7 in our 2024 cohort. But it just again shows the variety of specialisms we cover. And I think really it's beneficial to the trainees. So especially for the specialisms where there's only 1 or 2 trainees, they've actually got this network that they can kind of rest on, not just for the purposes of the STP, so things of the shared modules, but also just for a social reason. So a lot of our trainees are quite new to the area, and it's quite a daunting thing starting the STP. So they've just got a support network when they initially start them. So the locations we cover, as Judith always mentioned, Newcastle is kind of our base, and it's the hospital, the trust that everyone's recruited through. But we also go over to Carlisle and down to Middlesbrough. So we've got kind of a lot of different hospitals around who will help support the training. We'll have people based kind of all over the north, depending on their specialism. So my role as the training coordinator is essentially responsible for the day-to-day running of the Northern Training Consortium. So I'm essentially the line manager to the trainees. So this includes things like sickness, annual leave, and pastoral care. So on the sickness front, we have a lot of support from our admin team, but the trainees will let both myself know and their supervisor in their rotation or their training officer within their department. But I'll be in charge of kind of running all the return to work interviews and just making sure everything's documented correctly. Similar with annual leave, the trainees will let both myself, our admin team, and their current placement know about any annual leave and whether there are any clashes. But again, that'll just come through me to make sure that things go smoothly. So making sure annual leave isn't taken during university blocks or anything like that. And it just means that quite a lot of the admin is taken away from the training centres. So for the people that are supposed to be training officers that are there to be training in a specialist area, it just takes a bit less, well, it takes some load off them, so they can kind of concentrate more on the training rather than having to do the admin side on this side. And a pastoral care side of things, I regularly meet with all the trainees, so it's just another point of contact. So if they're having any issues, then they can come and speak to me. They've obviously also got their training officers within their field, who they'll be meeting regularly with as well. So it's just having kind of a few people there that they're able to talk to. Also there for a point of contact for training officers and supervisors. So if any of them feel that a trainee is struggling, they can come to me and have a chat through things. Or if they're unsure on what's expected for a certain training activity, then again, it's just a point of contact there so they're not struggling to find the right information. Oversight of our quality management system. So we run on our quality management system through QPulse. So all our training plans are on there, any relevant forms, our statement of agreement, so everything like that. So as part of my role, it's just making sure that that's all up to date and that all the trainees are aware of all the processes in place. So things like the expenses system, how to take annual leave, what to do during sickness, it's all on there. And it's just making sure everything's up to date. Dissemination of information from the national school and any other relevant stakeholders. So when we get information from the national school, I'm aware that some of our trainers don't always see the relevant information. So when we find information that's actually really important that they really need to see, it's kind of just highlighting this to the trainers and the trainees as well, in case they've missed things. So they're all encouraged to get their regular memos, but we just make sure that they're actually receiving the correct information and acting upon anything that's needed. And then the final thing is the RCG applications. So as soon as we find out what trainees we're going to be getting, it's a case of submitting those applications as soon as possible so that the trust can approve it, and then we can kind of get the ball rolling in September as soon as possible. So kind of when the trainees first come, the induction period is kind of like the first big thing to do. So this is done for all the first year trainees within the Northern Training Consortium. This year, we've kind of had a split between just medical physics and pharmaceutical science, and a split between where people are located. So we've got quite a few this year based down in South Tees, and then quite a few in Newcastle. So we did a bit of a hybrid event where some days we did a full day up in Newcastle, and other days it was more virtual things. So our induction period usually runs for 3 weeks, and this is to tie in with the medical physics uni block. So we cover quite a lot of stuff during the induction. It kind of changes year on year, depending on feedback from the trainees, and just seeing what they think went well and what things would be useful for them. So as you can see, we kind of have the general trust induction, some bits from the national school for their induction. We give them some time to do some mandatory training and look over the pupils' documents. So just making sure that they're aware of what's expected of them. Some time for departmental tours so that they can get introduced to the departments that they'll be working in, and get to know some of the STPs in the higher years as well. We then had a general introduction to the NTC, and this was the first time this year that all the trainees could then meet each other. We have quite long lunch breaks during the induction period to allow the trainees to kind of network and just get to know each other a bit better, just so they can build those relationships to have that support network. A bit on health and safety, because that's part of our induction. And then some of the higher year trainees then do a talk on what they wish they knew before starting the STP. So just little hints and tricks about things that kind of came as a surprise to them, which everyone found really useful. We then have just some other bits and bobs. So again, some more time for mandatory training. They attend the 3-minute thesis, which is a medical physics thing at Newcastle Uni, where the MSc students present their projects. We've had the library come in to do a section on literature searching. So just showing what resources are available within our trust. And then the other bits are kind of workshops based around some of the training activities for the professional practice module. So we've got a mental health talk, a social media policy talk, and then that gives the trainees an opportunity to then write up those first training activities. And the final thing is a presentation. So we kind of throw them in at the deep end and ask them to do a presentation in front of kind of all the departments within the NTC, which I think they find quite daunting, but also a really useful experience. And a lot of the trainees have been really grateful to be able to do some of the training activities during this induction period to kind of see how one file works, and just kind of get the ball rolling. Because we found the first submission of the first training activity seems to always be the hardest, and a lot of the trainees seem to put that off quite a bit. So just having that time in the induction's really useful. So organisation of rotations for medical physics is another role. So this year we've had 6 trainees. We often have either 4 or 6 trainees. So as you can imagine, trying to timetable for this is a bit of a nightmare. The way we work for medical physics is the trainees train in pairs. So we try and match the trainees as best as we can, kind of based on the limited knowledge that we have of them as to who would work best together. And then we speak to the departments who could host the trainees and then schedule this around any annual leave provided by the trainees, which we ask for in advance. So it's a bit of a jigsaw, but this comes out with the first year all planned for all the 6 trainees. Similarly, for the first year, I'm in charge of doing the rotations for clinical engineering. A bit of an easier job with just 1 trainee. And again, it's just discussing with different departments when the trainee can come and ensuring that a training plan is in place for each of the rotations. So these training plans are available for each specialism, and they kind of just go through each of the rotations, what the considerations are, and kind of examples that can be used to achieve the tasks. So as I say, they're available for each of the things that we do. The Professional Foundation of Healthcare and Clinical Science, so the mandatory one for everyone on the STP, that's also something that I kind of run for all the trainees. So this is the training plan for that. Again, we have a list of all the training activities, suggested evidence, and then a rough timescale of when it should all be completed. We also meet at some time in the year just to discuss this, and it gives the trainees a chance to come up with some of their own ideas of what they've been doing. And then through those discussions, it can then help the other trainees to think of actually what they've been doing that is similar or might spark some new ideas for them. A lot of the marking comes through to me because it is quite generic information. So again, it just takes some of the pressure off the training officers so they can actually spend their time concentrating on the specialism training rather than the professional foundation side of things. And again, it just kind of means a fair marking as well. So if all the trainees, a similar standard is expected of all of them, and we can see this through the information that's submitted. And then the other module is the individual professional development module. So again, I'll work with the trainees to complete this unless they want to discuss this particularly with a training officer if they've got a specialist interest in something else. So I'll meet with them to discuss the area that they want to develop and then what aims they have of that. And then I'll also do the marking for their development aims and after the event, or just the general module. And we arrange a presentation day so that the trainees who have done their individual professional development module can then present to the other trainees. So not only does this obviously tick off their final training activity for this module, but it's actually really useful for the other trainees to see what everyone's been up to and give them some ideas for the individual professional development module. As Jude mentioned, we do a number of workshops. So one of them is the endpoint assessment workshop. So last year we did one on the IAC. So just collating all the information from the school and making sure everyone has that information. We also get in a previous STP so that they can explain how they went about tackling the IAC. Obviously, things will be a bit different this year, so we'll put a workshop together to just help people with the endpoint assessment in that side. And we also last year got an advice from an assessor, just so we can get kind of that viewpoint as well, just to help the trainees as best as we can. Throughout the year, I have regular meetings with the trainees just to check in, make sure they're fine. During the induction period, this is a monthly meeting for the first 6 months. We found that it's really helpful just to check in and check if anyone's got any issues. A lot of the trainees feel like they don't want to ask certain questions because they seem a bit silly. But if we're meeting monthly, then they have that opportunity just to ask those questions, and just let us know if they are having any issues. So things like being homesick or anything that we can help with, is just a good check-in point. There and after, we have 3 monthly meetings. So previously, we went through a phase of kind of not meeting and just having a meeting if a trainee wanted one. But I found that I spent a lot of time with some trainees and spent absolutely none with others. So I put these meetings in just to kind of make sure that I was actually keeping in touch with the ones who kind of didn't need that support as much, but might have had some questions about things or wanted to actually show what they've been doing, things like that. I've structured the meetings in a way where we'll set SMART objectives for the 3 months, just to make sure that we're kind of keeping on track with what things should be doing. And also just a bit of a reflection point. So things that have gone well in the last 3 months, things that haven't gone as well in the last 3 months, just so then before they come to the meeting, they can have a think about these things. Because the 3 months seem to go really quickly. And I think looking back on the spot, it's quite difficult to think of these things. So all the trainees come prepared to these meetings, having had a thought about things like that. Obviously, more regular meetings are put in with the trainees that need a bit more support. So I'll meet with the trainee along with their training officer. And depending on the trainee and what support's needed, will depend on obviously how we tackle it. But with some trainees, we'll meet monthly and set specific targets that are then needed for the next month. So as I say, it's working closely with the training officers and the trainees. The main thing really is communication. So just making sure that regular communication is happening not only with the trainees, but the training officers as well. So just some top tips. As I mentioned, communication is the main thing. So as I've said throughout, it's kind of just making sure that everyone's aware of what information they need to be aware of. Having regular meetings with the trainees just to check in and check everything's all right with them, but also making sure communication's happening with the trainers, making sure that they're feeling comfortable that they can approach me if there are any issues, anything like that. Organisation is definitely a key part of it, and I've found that things have come around much sooner than I expect. So the induction period always seems to sneak upon me. So it's just making sure that everything is organised in advance, making sure that those timetables are published early so the trainees are exactly aware of where they need to be. And the trainees all seem to be very grateful that they've got quite specific timetables and they're aware of what needs to be achieved and when. Utilising experience of others. So although we don't get any funding for it, I am still part of the practitioner educator network. So that gives me the opportunity to kind of discuss with other trainers how they do things. And it's just utilising the information that they have. So our professional practice module, I've worked with other people to be able to develop that SOP. And there's no point when other people are doing the same thing, there's no point in repeating information. So it's just, utilising the experience of others. As I mentioned earlier, passing on relevant information to trainers and trainees. So just making sure that all the key points are actually disseminated to people, just to make sure that they are actually aware of it. And then finally, just getting to know the specialisms and the trainers. So for us, as we cover quite a number of different specialisms, there's quite a lot of information to take in. So my background's in clinical engineering, so I have a bit of knowledge of the other areas before coming into this role, but I found that actually getting to know the different roles and having tours of the departments by the trainees and kind of taking an interest in their projects and things like that, it's kind of broadened my knowledge of things, but it also means that when I'm kind of helping the trainees, then by having that knowledge, it kind of helps them further. And like I said, getting to know the trainers, having a good bond with those means that if issues do arise in a department, that the trainers feel comfortable coming to me to let me know about things. Or it just means we can work well together to make sure that the best training is delivered. And that's everything on my side. So we'll open up some questions.
That's great. Thank you both. So we've got some questions here. So the first one is genomics not part of NTC?
I think many years ago there was a genomics trainee, but I think there's only ever been one, and there hasn't been any during the time that Charlotte and I have been in post.
Okay, thank you. Are the apprentice training courses separate to the external academic teaching? Can you provide examples? Also, do you find they have sufficient time to attend?
Yes, so it is a separate so they are going to go to UWE for their formal education or the formal academic qualification, but this is just an introductory course in the first sort of month or so. The UWE course, I think it's quite generic in year one, and then it sort of gradually gets more specialist as they go through the different years. So the idea of the course was just to give them a good grounding in, say, nuclear medicine or radiotherapy at the very start before they even went to UWE. So they can put what they're seeing in the workplace into context and just get a little bit of a head start. They do have time, so it was agreed with all the training centres that they would be released for this. We did it like one afternoon a week. I think it was on a Wednesday maybe, but it was agreed with all the training centres when would be a good time, and it's done over Teams so that they don't need to travel.
That's brilliant. Thank you very much. And do you know your retention rate for level 4 and level 6 apprentices?
I don't know. Top of my head. I know that in radiotherapy, I think we've kept pretty much all the apprentices we've trained. I think they probably have quite a good retention rate in nuclear medicine, but I don't have a figure like we do for the FTP. So something else, I'll look into that.
Thanks, Stu. Do you meet the trainees in person or over Teams, and how regularly do you meet them?
So I try to meet as many trainees as possible in person, just because it's a bit nicer, both for myself and for the trainees. So the bulk of our trainees are actually in Newcastle, split across 2 sites. So I work across both sites and kind of just timetable my days to book in with certain trainees on certain days. Obviously, it's not possible to meet all of them in person, especially with some down in Middlesbrough. So in those cases, it is a case of meeting over Teams. Or if trainees are working from home on certain days, we also meet over Teams then. And then meeting them in the first 6 months, we meet monthly. And then following that, we meet every 3 months.
That's great. Thank you, Charlotte. How do you provide new information from the school to trainers? How do you ensure that trainers have reacted and taken on board the new information? That's a big question.
Yeah, maybe we'll share that. I'll do the first bit. So I think it depends what it is. Often if information's come via emails, then we can forward that around. We have email distribution lists for trainers, for trainees, for graduates, for people on the board. So that's a good way of circulating things. When there's been a lot of changes at the same time, like there was recently for STP, there were changes to the forms people did, the way the competencies were labelled as developed. I can't remember what the 3 things were, and changes to progression reviews. We made a big crib sheet, a couple of sides of A4 of all the changes together, and then circulated that document. How to ensure that trainers have reacted, I'm not sure. What do you think, Charlotte?
I think it's quite difficult. I think, as I mentioned, we have quite a good relationship with most of our trainers, and we meet with them regularly along with the trainees. So in some cases, I know that they've not read the information from their reactions to a discussion. But then it's a case of, I think they're aware that they don't read the emails sometimes. So we can then kind of just disseminate, give them the information again, and just highlight the importance of what we're sending them, I guess.
That's great. Thank you both. Is there anything you can share about the trainee travel and accommodation arrangements, please? Always tricky with different sites for different rotations.
Yeah, so on the travel front, when we do the planning, we try and limit travel as much as possible. If a trainee is based at another site for more than 4 months, then they're expected to relocate for that time. So they'll be asked to kind of cover accommodation costs themselves. Most of our placements are actually a lot shorter than that. So usually about 8-week placements. So for trainees based in Newcastle, if we set them down to Middlesbrough for that 8-week, we would then cover travel or accommodation costs. It kind of depends on where they're going or what's needed. We often either get kind of a house share for them all, so they can stay down for that full 8 weeks, or some trainees prefer to commute for that time and we cover the costs of that. It kind of works on a bit of an individual basis on that side. We have some trainees at the moment down in South Tees, and even within that area, there's quite a few different hospitals to visit. And for some of the trainees, they have to be in early, so about 6:30 starts at hospitals that are not as easy to commute to. So again, we then arrange for hotels for them. So essentially what happens is a trainee will ask for certain dates in a certain location, and our admin team will then support us to try and find the most suitable options, and then it'll be booked through our trust travel system.
That's fab. Charlotte, how much time is this your role, or is it a full-time role? Or does it just feel it?
It definitely feels like a full-time role, but it's 2 days a week.
Okay, that's great. It's never enough, is it? I'm sure you feel that with anything like that, yeah. In terms of those interested in work experience, are these people in the NHS? And if not, how do you manage honorary contracts, access to patient information?
Yeah, so we say work experience, but what we really mean is visits from people that are interested in maybe coming into the healthcare science profession. They might be doing undergraduate degrees and thinking about SPP or apprenticeships, or sometimes we get requests from people at school doing their A-levels, thinking about what careers to go into. So it's very sort of high level, just tours of the department, getting to meet current trainees and discuss with them what it's like working in healthcare. So it's the honorary contracts, not really a problem, and we wouldn't be putting them in situations where they would have access to patient information. So we're not talking about extended sort of periods where they're actually doing real work. It's more just visits to help with applications.
That's fab. And Wayne's just made a comment there. So as a new training officer with multiple SDPs, the NTC has been really supportive, enabled us to get our programme up and running relatively smoothly. So that's really positive to end on, unless we've got any other questions at all, because we've got plenty of time. That's brilliant. Thank you very much. So it just leaves me to say thank you both for your talks today. And thank you to everybody who's joined us and asked the questions. And like I said, the recording will be on our website in the very near future.